Hey Mir, what's going on? How are you?
Hey, Dr. Lenny, how's it going? I'm doing well.
Good, good, good. So listen, man, October is physical therapy month, right? And so
Yeah.
I thought it would be awesome for October and physical therapy month for us to interview our entire clinical team. Tell a lot of the folks that follow us on Facebook, a lot of our patients, a lot of our friends in the community about about who we are as people and sort of what got us into this wonderful field of physical therapy, why we celebrate it so much in October. So listen, let's start from the beginning. So tell me why you decided to become a physical therapist.
Yeah, so I've always been interested in biology and health and learning about kind of the systems ever since high school, right? I got to, AP Bio, that did it for me. I was like, all right, this is what I didn't know what I wanted to do with it, but it's like, okay, med school, I don't know, right? So I was a bio major at TCNJ. I wanted to be a pharmacist, believe it or not, in the beginning, I had gotten my material for the PCATs. I studied for the PCATs, which is the pharmacy school admission test. And that summer, I did an internship I actually worked at a CVS with a pharmacist. I kind of left that. I think that pharmacists very important people, obviously, but wasn't for me. I was just sitting there, not moving around, not really developing relationships, I feel like. And I was like, well, that's it. And after that, I was like, oh, what do I do? So, in college, I looked to, what did I actually enjoy? I loved exercising. I loved working out. And in college with a buddy, we started teaching people, in the weight room. And we started, novice lifters and everything. And I started to see the benefits of that and how people were improving day to day. And that gave me like a thrill. You know what I mean? That gave me like genuine satisfaction to be able to see someone do a deadlift properly after a couple weeks of trying to teach them.
Sure.
And then lifting heavy weights and trying to make that their lifestyle. And I was like, wow, this is great. And then I discovered, well, there's a career for this. So that combines kind of the love of the medical side of it and also spending one-on-one time with people, teaching them how to be better movers in life.
Sure. Yeah, that's awesome, man. That's a great story. I love the passion. It's so true. I think all of us as physical therapists, I can't say, I obviously.
So my doctorate was from NYU Steiner, and it was a phenomenal place. So that was a 3.5-year program there.
That 3.5 was above and beyond your undergraduate, right?
Yeah, so I got my undergrad at the College of New Jersey, formerly known as Trent State, before my time. But right afterwards was NYU. So that was 4 years. That was a Bachelor of Science in Biology. And then the 3.5-year program at NYU for my doctorate. Yeah, there's a great program in the city. It's one of the more renowned physical therapy programs. It was one of the first physical therapy programs. It was also one of the either first or second to start doing the doctorate program in early 2000s. Dr. Marilyn Moffitt, the director of the program.
Why you love being a physical therapist?
Yeah, so it's kind of like what I thought it would be, right? It's teaching people. It's being able to have a patient come in and say, I feel great today. I can walk without pain. Like those are that's
it's the best.
Euphoric, man. That's and they're like, thank you so much. What? Right. So that's incredible to have that level of change in someone's life. I can walk without pain. I can bend over. I pick something up for the first time. Right. That's the first time I did that in 3 years. So obviously that part, and then also being able to spend so much time with people. I think it's so rare, and in any profession, right? And really developing relationships, knowing about someone's family, knowing about their grandkids, knowing about, their ideas, their passions, and at the same time, you're helping them get better. But developing these deep-rooted relationships, I think that lasts for a long time. So
Absolutely. Yeah, no, it never gets old, right? Having that kind of effect on somebody's life. I mean, I think you said it well. You said it excellent there. So you're like I said, you're a bright guy. We recruited you for a reason. A phenomenal doctor of physical therapy. You could have worked anywhere you wanted, really, right? And why'd you choose ProFysio? Why'd you choose to work ProFysio physical therapy when essentially, you had a lot of options when you came on board? And then probably more importantly, why do you stay?
Yeah, definitely. So this is a good field to get into, right? There's a lot of jobs available. So, as a new grad, when you're thinking about where to go, there's several criteria that I thought were important to me, right? So, and those were, nothing against the big places, they're successful for a reason, etc. But to me, and I had several, I don't want to sound arrogant or anything, but I had a few offers on the table, right? A lot of, I think, new grads do. So it's like picking the right place, right? So in ProFysio, I actually sought out Dr. Lenny. I bugged him. I was like calling multiple times. I was sending him emails, and finally he got back to me. I was like, all right. So, I was seeking out a clinic that was smaller in size, in where I would get to see patients for a longer period of time. And it's very rare to see 2 patients an hour, right? You don't see it. And so finding a clinic that has a really good vision going forward, that actually care about people, that's small enough to where, I can text Dr. Lenny like every other day and work on things. Like, you get a big clinic, like you're not going to talk to the owner ever, right? And so you're not getting that experience from them. You're not getting to learn from them and really engage in this whole, profession. And there's an incredible team here, right? There's some really wonderful doctors of physical therapy, and being able to meet with them and work with them and exchange ideas with them. And it helps me keep growing. It helps me stay on my toes. And also learning from the business side, like learning about the art of, running a business, and taking care of people at the same time. I think it's phenomenal.
Yeah, well, I mean, it's a pleasure having you, man, and I'm glad that you say that. I mean, for us, we want to continue to grow, but I can tell you for sure, we always want to have that connection with our team, right? I mean, no matter how big we get, I always want to be able to be available, via text or phone call. So, but it's obviously a pleasure to have you on board. I give them what my input is. I essentially, tell them to look for a place like mine. But I want to hear your input. What do you think is the single most important thing to tell a patient about how to find the right facility for them?
Yeah. Find a place like ProFysio. I think there's certain key points you need to look at, right? You need to do a little bit of research into where you're going, right? You need to do some research into the reviews they get. You need to do some research into how many patients they see an hour, right? You need to do a little bit of research into what the therapists are like. Does this place care about the patient enough to, tell you a lot about the therapist? And once you find that out, you want to consider a place and a therapist that, is honest with you, is going to be transparent with you, is really not going to rush the process with you, right? It's not going to try to sell you on anything. They're going to be able to communicate with you honestly and really develop a plan for you as a person, right? The multiple dynamics that you come with, and not just, okay, this is another knee replacement, this is how I'm going to treat it, right? That's never the answer. Everyone's different, and they have to be able to cater to you specifically and treat you specifically. Yeah, so important, man. Well said. I think I advise people the exact same thing. I think a lot of physical therapy facilities sort of throw around the term individualized care, right? Everybody says that. Everybody's one-on-one, everybody's individualized. The fact of the matter is, you got to ask some really pointed questions to truly find that out. And I think when folks call us, if they ask those questions, they're going to be happy with what they hear. And you couldn't agree with you more. It's not about just the condition. It's about the patient as a person and all of the circumstances, the times that they need to come in or the times that they can't come in, affordability, the condition that they have, another physician they may need to see. It's all of it. You can treat the person as a whole. So important. Trying to let you in.